Number 4. Intoxication from medicines. The etiology of cognitive impairment often involves multiple factors, making it difficult to definitively attribute causation to a single medication. Studies of elderly hospitalized patients have shown that medications are implicated as the cause of delirium in 11 to 30% of cases. In addition, drug toxicity is observed in 2 to 12% of patients with suspected dementia. In some cases, central nervous system (CNS) toxicity occurs in a dose-dependent manner, often due to interference with neurotransmitter function. Elderly patients are more susceptible to cognitive impairment from drug use than younger patients. This susceptibility is influenced by age and disease-related changes in brain neurochemistry and drug metabolism. Long-acting benzodiazepines are the most common drugs known to cause or worsen dementia. Anticonvulsants have the potential to cause delirium and dementia. Histamine H2 receptor antagonists, cardiac medications such as digoxin and beta blockers, corticosteroids, nonsteroidal anti-inflammatory drugs, and antibiotics can all contribute to acute and chronic confusion. Prevention of drug-induced confusion includes avoiding polypharmacy and following a start low and go slow approach to medication initiation. Special care should be taken when prescribing for people with cognitive impairment. Timely recognition of drug-induced confusion and discontinuation of the offending medications are critical steps in management. Number 5. Severe depression. Dementia is often accompanied by mood changes. As people begin to experience memory loss, challenges with socialization, and difficulty with daily tasks, feelings of depression may emerge. There may also be a link between dementia and depression that goes beyond these immediate effects. Experiencing depression earlier in life could potentially increase the risk of developing dementia later in life. Stay tuned as we continue to explore the relationship between depression and dementia. Studies suggest a link between depression and an increased risk of dementia. A Swedish study conducted in 2020 compared the risk of dementia between people with and without depression. The results showed that those diagnosed with depression had an increased risk of developing dementia. The risk of dementia was particularly high in the first year after being diagnosed with depression. Although the risk decreased over time, it remained significantly higher more than 2 decades after the initial diagnosis of depression. In addition, the researchers observed that elevated depressive symptoms in early adulthood, ages 20 to 49, and later in life, ages 70 to 89, were associated with late-life cognitive impairment and a faster rate of cognitive decline. The cognitive changes associated with dementia can significantly affect a person's mood and emotions, often leading to the emergence of depression as a symptom. It's not uncommon for depression to be a symptom of dementia. According to a 2015 review, up to 40% of people with dementia may experience depression. In addition, many symptoms of dementia overlap with those of depression, including difficulties with memory and concentration, feelings of sadness or hopelessness, loss of interest in previously enjoyable activities, and social withdrawal. Because of the considerable overlap in symptoms, diagnosing depression in people with dementia can be challenging. Whether occurring independently or at the same time, people with symptoms of dementia or depression should be evaluated by a healthcare provider. Early intervention and treatment can significantly improve quality of life. Number 6. Hypothyroidism. A recent study suggests that older people with hypothyroidism, commonly known as an underactive thyroid, may have an increased risk of developing dementia. In addition, the risk appears to be even higher in those who require thyroid hormone replacement medication for their condition. Hypothyroidism occurs when the thyroid gland does not make enough thyroid hormones, which can slow metabolism. Symptoms may include fatigue, weight gain, and increased sensitivity to cold. The study was published in Neurology, the Journal of the American Academy of Neurology. Researchers analyzed the medical records of 7,843 people in Taiwan who were newly diagnosed with dementia and compared them with an equal number of people without dementia. The researchers examined the medical histories of both groups to identify those with a history of either hypothyroidism or hyperthyroidism. The researchers did not find a link between hyperthyroidism and dementia. However, after adjusting for other potential factors influencing dementia risk, such as gender, age, hypertension, and diabetes, the researchers found that people aged 65 and older with hypothyroidism were 80% more likely to develop dementia than their peers without thyroid problems. However, among people younger than 65, a history of hypothyroidism was not associated with an increased risk of dementia. Furthermore, when researchers focused only on individuals taking medication for hypothyroidism, they found that they were 3 times more likely to develop dementia than those not taking such medication. Number 7. Vitamin deficiency. Vitamin D deficiency. A study published recently in the American Journal of Clinical Nutrition suggests that vitamin D deficiency may increase the risk of dementia. The study looked at more than 294,000 people, mostly women over the age of 60, living in the United Kingdom. Researchers used blood tests for all participants and neuroimaging tools for approximately 34,000 individuals to examine the associations between vitamin D levels and the risk of dementia and stroke. According to this observational study, individuals with low vitamin D levels were found to be 54% more likely to develop dementia than those with normal levels. Vitamin B12 deficiency. Vitamin B12 deficiency can lead to cognitive impairment, including problems with thinking that can mimic symptoms of dementia. Older adults are more susceptible to vitamin B12 deficiency because they are more likely to have difficulty fully absorbing it. That's why it's important for people with older loved ones to be aware of the possibility of vitamin B12 deficiency. Unlike dementia, this health problem can be reversed with proper treatment. Well, this is the second part of 7 causes that can trigger dementia. If interested, you can watch the first part of it on this channel. If you have any questions or comments, please leave them below. If you found this video helpful, please like and subscribe. Thank you for watching.